Okay, looks like it slowed down a little bit. So, like I said, this is Brett from the Health Department, and this is our update call for our 10 county jurisdiction. So, Kevin's going to provide a presentation, some information on various topic areas. So, and before we get to Kevin, I want to give some housekeeping items. So, first is we're going to record this. So, if there are people who weren't able to make this call, in a couple days, this will get posted on our website, and then they can just listen to it at their leisure. And I don't know exactly where that's going to be at this point. So, well, I can email everyone who was sent an invite. So I will send out an email to everybody and let you know exactly where you can find that on our webpage, and then you can forward that out as you see fit. So recording was the first one. Second one is we're going to have a lot of people on this call. So if you are joining the call via your computer, please make sure that the icon on the left with the little microphone has a line through it so that you're muted. And if you're on your phone, please just mute your own device, because what will happen if you're on this via your computer, there'll be a lot of reverberation if your microphone's on and someone else is talking, because then your computer mic picks it up and it can be an issue. So just please double check, make sure that whatever you're using is muted. Like I said, in a second, we'll turn it over to Kevin and he'll present. And then for those who are new to Teams, there's a chat box. Looks like a little text icon. We also do a weekly call for our school systems within our 10 county jurisdiction. Our Dr. Morse, the medical director, does that call.
Yeah, the health department. Somebody's got their cell phone and their computer on, like you just described, and there's a lot of reverb. You can't hardly understand what you're saying, sir. So if everybody could check to make sure you're on mute, and if you're on your cell phone and your computer, can you please correct that so we can all hear the call? Thank you.
Are you still there, Brett?
Can you hear me?
Yep.
Okay. So like I was saying, with the text box, you can just type in your question, and then it will keep a running tally. And then at the end, Kevin can just run down the list of questions and answer them first come, first served. If you have a question that would take you a long time to type out, too long, or you need to have a discussion about it, you can just type in there, I have a question. And again, once Kevin goes down the list and he comes to you, you can just unmute, and then you can talk to Kevin or ask your question directly over the microphone. Looking at my list, see if there's anything else. Oh, I guess the last thing is at the end, Kevin will also talk to you all about how often you want to hold this meeting. So is it something, weekly, every other week, once a month? We can make that decision once Kevin's done. So I think that's about it for the housekeeping. So Kevin, I'll turn it over to you.
Okay. All right. Thanks, Brett. Okay. Well, thanks guys for taking time to get on this meeting with us today. I know, in the past we've been doing individual county meetings, and it had gotten to the point where, counties began to think that or feel that maybe, we were at a place where we didn't need to continue to do these. And so with the increase in cases that we've been seeing, we thought it was probably appropriate to bring everybody back together again and provide an update, and then ask to see if there is interest in continuing with these updates. So as Brett said, we'll do that at the end. We'll go ahead and start just like we had with our individual county meetings by reviewing, the county and the jurisdiction-wide data. And to do that, I've asked Jordan Paul, our epidemiologist, to kind of provide an overview of the data and maybe a little bit in terms of kind of what we're seeing in the jurisdiction. And after she gets done with that, I'll provide a little bit more information in terms of COVID vaccine, flu vaccine, and then kind of what we're experiencing or what we're seeing within the healthcare systems in our jurisdiction. So, Jordan, if you're there, I'll turn it over to you to review the data.
All right, I'm here. Can you hear me?
Yep.
Okay, perfect. All right, so in the month of October, all 10 of our counties have seen an increase in COVID-19 cases. The individual county profiles and a jurisdiction-wide profile will be available soon on the District Health Department number 10 website. In the past week, cases have been identified from school exposures, including preschools and daycares, K through 12 schools, colleges, many household exposures, worksite exposures, church exposures, and cases among healthcare workers and a couple of long-term care facility outbreaks. There are still many ongoing case investigations at this time as well due to our large influx of cases. So as of yesterday at 3 p.m., there were 3,791 COVID-19 cases in our jurisdiction. Crawford County has 172 cases. Kalkaska County has 176. Lake has 95. Manistee County has 187. Mason County has 330 cases. Mecosta County has 751 cases. And the Ferris State University dashboard is reporting 377 cases. So the Ferris State cases are included in our Mecosta count if they are completing their isolation period at school in Mecosta County. If they go home, they will be counted in whatever county their home is in. Missaukee County has 138 cases. Newaygo County has 904 cases. Oceana County, 778 cases. And Wexford County, 260 cases. And as of yesterday, there have been 43 deaths in our jurisdiction and 1,807 cases have recovered according to the recovery criteria of being alive 30 days after diagnosis.
Okay, any questions for Jordan on the data or the numbers? Okay, probably over the last, as we look back over the past week, on a daily basis, we're seeing anywhere from probably 80 to 100 new positive cases in the jurisdiction. And so obviously this is creating quite a burden, quite a strain on our staff as well as on the state folks that we have assisting us in doing case investigation and contact tracing. And so, I mean, I'll be honest with you, we are probably 2 to 3 to 4 days behind in being able to contact individuals who do test positive. And so this is really kind of requiring us to rely on our partners, whether that be the schools or the work sites or, our county folks, that when, you get notified of a positive employee or a positive worker, if you're able to help make sure that individual is aware that they have to isolate, and the isolation period is a minimum of 10 days from the onset of symptoms, and at that minimum of 10 days, provided they are fever-free for 24 hours without any fever-reducing medication, their respiratory symptoms have improved and all other symptoms have improved, they would be eligible to be released from that isolation period. On the same note, anyone who would be considered or identified as a close contact to a positive person. And the current definition of a close contact is going to be anyone, an individual who has been within 6 feet of a positive person with or without a mask for an accumulative of 15 minutes in a 24-hour period. So that could be, 3 minutes in the morning, 5 minutes in the afternoon, 6 minutes in the evening. If that total time equates to 15 minutes in a 24-hour period, that person is considered as being a close contact. And close contacts have to quarantine for 14 days from their last exposure. As I said, eventually we will get to those individuals and conduct a case investigation and then reach out to the close contacts. If necessary, we do provide a isolation or quarantine letter, as well as the release from isolation or quarantine letter. All individuals have to do is ask us for that, make that request to the health department for that information. As the cases continue to increase, I expect that we're going to continue to see this volume of cases and this burden on our staff to try and complete case investigations and contact tracing in a timely manner. So again, anything that our partners can do to help us through this process is going to be greatly appreciated. Now, at the same time we're seeing this increase in cases, we're also kind of seeing the same thing happening within our healthcare systems. And on a weekly basis, I do reach out to our healthcare systems to kind of assess what their current capacity is and where they're at in their ability to care for and take in COVID positive patients. And, this week, it was across the board that in all 10 of our counties, and I believe we have 8 hospitals that cover our 10 county area, that, they are beginning to feel the impact of this. A number of them are operating at 80-85% capacity in their ICUs. And while they may have beds available for patients, they don't have staff for a variety of reasons. Some of them they have staff that are quarantined. Some of them, they've had staff leave. It's just a whole host of issues. And so it's not just that we're seeing an increase in cases, but we're also seeing, an increase in some of these cases requiring hospitalization or medical care that is impacting our healthcare system much greater than it did when we first started with COVID way back in March. And I think it's fair to say that what we're seeing now is of greater impact than it was back when we started, with COVID, so way back in March. So those are some of the things that we're seeing in our jurisdiction, and some of the things that we're noting in our jurisdiction. We do continue to work on flu clinics and implementing flu clinics throughout our jurisdiction. It's important to note that we were fortunate this year in that we were able to get some vaccine that we can use to target the uninsured or underinsured individuals. And so between the health department and our healthcare partners and providers and pharmacies, I feel pretty confident in saying that this year, anyone who is interested in getting a flu vaccination should be able to get one. They should not have an issue finding one. Now, if they are uninsured or underinsured, feel free to have them reach out to the health department, and we will do what we can to, get them vaccinated for the flu. Along those same lines, we have begun internal conversations and discussions regarding the COVID vaccine. We were on a call with our state partners last week, I believe it was, and at that time, they believe the potential is there for us to possibly have vaccine at the local level, potentially the end of this month or by the end of December. Now, again, that's all going to depend on all of the stars aligning and everything working out. It's important to note, though, while we may have vaccine available, the ability to do any type of mass vaccination community clinics we're still a ways away from that. The vaccine that we initially get is really going to be prioritized for the vulnerable population. It's going to be prioritized for healthcare workers, our hospital folks, our EMS first responder type folks, and then, as I said, that vulnerable population. I believe that, we're probably looking at possibly late spring or summer before we'll really be doing any type of mass vaccination clinics out in the community. And, once we begin planning for those, then there will be a whole host of other individuals that will be looping into to that conversation to kind of plan for that. So that's a little bit on the COVID vaccine in terms of what we know and what we've heard. The flu vaccine, we know we do have some control over that because we have vaccine in stock and we can provide those clinics. The COVID vaccine is still something that we're going to be waiting on. So we'll keep you informed of that. More information, becomes aware of that. I think as we, as we're moving forward and looking at the cases, Jordan kind of gave you an overview of what we're seeing in the jurisdiction, but far and away, the biggest contributor to the increased number of cases that we're seeing is among individuals who have been out attending gatherings or large type of events. Inevitably, we have individuals that will be symptomatic and feel that it's more important to go to such an event, or there will be somebody else at one of these events that will be sick already, and that is what leads to the infections that we're seeing. So far and away, that is the biggest reason that at least I believe we're seeing this huge increase in cases, and this is not simply just limited to our 10-county jurisdiction. This is something that we're seeing across the entire state. I was on a call with some of my peers, fellow health officers across the state of Michigan, and they're seeing the same thing. It's the large gatherings and the get-togethers that are creating the biggest issue. And that is, we have Thanksgiving coming up and we have Christmas coming up. And so, I think the expectation is that following Thanksgiving, we may see another spike in cases because of gatherings and events that are going to take place during that time frame. So that's kind of most of the information that I have to share. And so I'll go ahead and we can kind of open it up for questions. I think there might have been a couple of questions that popped into the chat box. I'm not sure, but if anybody has anything before we get to that.
Yep, Kevin, there is one in the chat box, and if others come up, feel free to add that to the chat box. And then I think what we'll do once we're done with the chat box is that we can open it up to anybody that's on the phone who's not on their computer and can't do the chat box. We can open it up then. But what we wanted to try to avoid is having 8 people try to ask a question at the same time. So the chat box seems to work well for that.
Okay.
So Kevin, can you see that question?
No, I can't. Can you read? Do you mind reading those?
Yep. So it says, hello, Kevin, given the time frame from the onset of symptoms, 1 day or 2, scheduling the test 1 day or 2, and getting back at 3 to 4 days, we end up with a 5 to 7 day calendar process before quarantine. Doesn't this delay in getting tests taken and back hurt the overall purpose of quarantining and thus perpetuates the spread of the virus? If yes, what might be the next step in our process to improve our numbers?
Yes, it does impact that ability, and the thing that could happen to improve that is going to be increase ability of individuals and have those tests turned around in a quick time frame. I believe right now In most instances, it's taking, if you're lucky, you're getting your test result, provided it's not a rapid test, you're getting your test turned around in probably 36 hours, can be up as high as 72 hours, which, if you're not getting tested until 2 or 3 days after your symptoms have started, you're right. You're already potentially, 7 days have gone by of your isolation period. And you've had most likely interacted with how many other folks that now we have to quarantine. So far and away, the thing that would help us out the most is just some increased testing capacity. And I know, we get folks asking, well, why isn't the health department conducting testing? And the fact is right now, we don't have anybody, I don't have staff to be able to conduct testing. I mean, all of our available staff are involved in doing case investigation and contact tracing. If we were to pull staff away to kind of resume the testing pieces that we have been doing before, or to begin to offer testing in each of our counties, our response time to some of this would probably go from, maybe 2 to 3 to 4 days up to, maybe as long as 7 to 8 days, which again is, almost the entire time of their isolation period. So, if we were able to get some additional testing capacity in the jurisdiction, I think that would help speed that process up. Now, again, when you look at labs that are running this, I know some of our hospital labs are running their own tests, but some others are still kind of shipping results out. And so, the minute one of those outside labs is saying, well, we can turn test results around in 24 hours, they get slammed with results. And before you know it, they're upwards again of 4 to 5 days. And so that's just a vicious circle that continues to happen. So, the testing capacity is a big contributor to that.
Okay, next question says, expectations for hospitals when we are asking patients to quarantine that were exposed to a positive hospital staff member?
Again, I think it's, reminding those individuals that if they have been identified as a close contact, to quarantine at home. Obviously, when we go through and do make contact with them, we'll conduct that case investigation to determine, is this individual truly a close contact? And again, a lot of that is going to be based on the input that we're getting from the positive individual. And the other, one of the issues that we're running into right now is individuals not wanting to provide close contacts, whether that be for fear that it's going to get them in trouble, or they just feel that they don't have to provide that information. That does create some issues in trying to quarantine people. So potentially you could have someone who has been exposed to a positive person and becomes infectious, and then goes out and still interacts with other individuals because we don't have their contact information, versus if we did have it and could hopefully get them to isolate at home. A lot of our partners, as soon as they identify that positive individual, they kind of begin to gather all of those close contact individuals and their phone numbers, and then they will actually email that list to us, and we can provide that to our staff, and then begin that, kind of start that process. This has been one of the huge benefits that we've had with our schools, who will actually start that process for us, and then provide us with the list, and then we can enter that list into the state's disease database, and then follow-up contacts and contact tracing can take place. So again, I know it may be difficult to admit that you've had a positive person and they may have exposed others, but again, it's more about getting the close contacts to quarantine and the positive people to get isolated to prevent the spread of this.
Okay, next question. I've just been notified that Spectrum will not be doing testing at this time for those who are determined to be a close contact. We've always advised those contacts to be tested after 5 to 7 days since their exposure. Thoughts on how to advise now?
And again, that goes back to the testing capacity. And I know our local hospitals have gotten slammed with results. They're testing already 8 hours a day. Five. Sometimes some of them are doing 7 days a week for testing, and that's just for symptomatic individuals. Within our jurisdiction, we have the closest locations we have in trying to get some testing done, for that asymptomatic population. We know that I believe still Northern Michigan Health Services, and I think I saw Gwen's name pop up on the list. Northern Michigan Health Services, the FQHC over in Shelby was doing testing, but I think they're doing 2 days a week. I believe they are still testing asymptomatic population. We also there is a site in Grayling. The state had set up what are referred to as neighborhood testing sites, and the state has contracted out with a company to come in and operate those facilities. So there is one of those testing sites on the campus of Kirtland Community College in Grayling. There is no cost for the testing there, but you do have to have an appointment. And we can get that information for individuals if they're interested. I believe in Grayling, they are testing on Tuesdays and Thursdays from 10 until 4, and then on Saturdays from 10 until 2. There also is a neighborhood, there's two additional neighborhood testing sites. One of them is in Muskegon, which for some of our southern counties may not be too far to go. It's located at Christ Temple Church on East Sherman Boulevard. There's no cost there, but you do need to have an appointment. They are testing on Mondays from 10 to 5, on Tuesdays from 10 to 5, and Thursdays from 12 to 7. And then there was just recently an additional neighborhood testing site set up in Kent County, the Grand Rapids area, and I don't have all the specifics for that. The interesting thing with these neighborhood testing sites is that they are testing using saliva tests. So it's not the nasal swab that you have stuck up your nose, but in the case of these tests, you're spitting into a vial, and then a sample of that is taken, and that's what's being taken down and analyzed. Just as accurate, the accuracy is pretty high with those tests also. But within our jurisdiction, aside from our healthcare partners, and then let me back up, because we also have our Walgreens, I believe in Ludington and Cadillac, that are doing testing. But again, you need to have an appointment. And the last time I talked with somebody who tried to get an appointment from them, they were almost a week to 2 weeks out in getting people scheduled. So within our jurisdiction, those are unfortunately the testing options that we have available.
Kevin Gwen commented, so I'll read hers before I go to the next question.
Okay.
Gwen says, Northwest Michigan Health Services in Shelby is still doing asymptomatic testing. Demand has decreased, so we're down to Tuesday, Thursday, 10 to noon for testing. We can increase if demand increases.
Okay, thank you, Gwen.
All right, next question. Is there an expectation of bringing in the National Guard testing sites again, or not, because temps have gotten cooler?
The National Guard is still available for testing. I do know our governor has sent a letter to the president asking for an extension. The Guard right now is with us through December. I think it's the December 31st of this year. I know she has requested an extension of that. Again, our ability to conduct that testing is really limited by our ability to have staff to be able to work it. If we were able to secure enough staffing to do that, it is something that we've talked about trying to do in our communities. The fact that we're getting to a colder time of the year really doesn't necessarily prevent us from doing that. We have some options. We could look at doing in-house. We have tents that have sides to them. So we could still look at conducting testing. It's really about having staffing to be able to conduct that testing.
Okay, next question. Are you recommending the Michigan COVID Alert phone app to the community to help with faster notification and contact tracing?
I think if that app works the way they're marketing it and saying it's going to work, it may be advantageous. I'll be honest, I've not, it's just out. I've not heard a whole lot about it. It was piloted down in the Lansing area around MSU campus. I've not heard anything in terms of how that went, other than I assume it went well because of the fact that they're rolling it out statewide. But that's kind of what I know about that right now. But it is something that I do want to try to find out more information out about, because if it does work the way they're saying, it may be, it could be advantageous to us to do that.
Okay, next question. Is there any data on how contacts become positives?
I'm going to refer that back to Jordan and put Jordan on the spot as the epidemiologist. I mean, I know, when we look at some of our data, we have a large number of household contacts. I mean, I think, was it last week or the week before when you gave me the data for Newaygo County, there were like 52 of them. And 52 different households cases where we saw that, but I don't know if you've got if there's a percentage.
Yeah, unfortunately, I don't have an exact percentage, but like Kevin, you see multiple cases within households. I know Newaygo, like you said, 42, and I'm blanking on what county I gave someone else data for, but there was like 48 different households that had multiple people that were confirmed cases within it. So I could look into it some more, but right now I don't have an exact number.
And Jordan, if you do find some data on that, you can just send it to me and I can send it to all the invites on this meeting.
Okay, perfect.
All right, next question. How would you like counties to proceed with requests for a National Guard testing site? If the county can contribute staff to help do the non-medical tasks, would that assist DHD-10 or make it easier to bring in Ming testing clinics?
If there's county, at the county level, if there is interest in conducting, some community testing, then, I guess I would ask that you send that information to me, or that request to me, and, we'll see what we can do. If we can partner, or partner amongst others to provide some, non-clinical folks, if we can arrange so we have guard there to do the actual testing, and then all we have to have our other, do the other stations associated with it, and it's not all going to be on the health department, then the potential is there that, yeah, we can do that. So if that's something that you're interested in, let me know and we'll see what we can do.
All right, that was the last question in the box. So in the chat box. So why don't we take a second here and see if anybody who is just on the phone would like to unmute and ask a question.
Yeah, hi, Kevin. This is Bob Selby from Oceana. I have just a quick question. Regarding our courts, I believe you had a conversation recently about the method in which some statistics are provided to the courts to know whether or not they can continue to advance forward in their multiple phase reopening plan, or if they have to fall back. Can you talk at all about whether or not there was an issue with the calculation leading up to our court recognizing that they needed to fall back?
Sure. When we originally started in providing the courts with their data, the MySafe Start map was not operational at that time, and so in order for us to get the data that the courts needed, we had to utilize data that was provided through the is it through the HAN, Jordan?
Yeah, it was through the HAN for the testing numbers and then using our own confirmed case data.
So there's a statewide system that supplies us with some of that data. And so because the MySafe Start map wasn't there, we started using that because we had to provide the courts with some data. We compare, and so once the map became operational, we compared a couple times to what we were getting using the HAN data and what the MySafe Start map was showing. And every time, it always showed pretty consistent and pretty close. That was up until 2 weeks ago, Jordan?
Yes, this next set of graphs will be the first round that we're switching to using just the MySafe Start data because it's already out there. So.
Yeah, because that's when the cases really began to shoot up, is when we began to see more of a discrepancy. And some of that may have to do with just the sheer number of cases. Some of it may have to do with the time lag and when that data was entered in. So, both systems were appropriate for gathering. We've just to the point now where the data that the Supreme Court, the SCAO, is requesting for jury trials can only be gathered off of the MySafe Start map, and so we have switched now to just using that data, so that everything is consistent.
Okay. All right. Thank you, Kevin.
Yep.
Kevin,
Great.
Jim Durham, Oceana County.
Yep. Go ahead, Jim.
Okay. My question, I got a phone call here from the general public that posed a question and I wasn't able to answer it. So I waited for our webinar today. Let's say an individual gets tested today. He is positive. He, for some reason, wants to go back and have another test done several days later. That comes back positive also. Is that two positives, or somehow is it calculated where they know that it's only one?
Jordan, if I'm correct on the HAN, that would count as two different tests. Correct?
I'm not sure about, yeah, I think in the HAN it would count as two different tests, but as far as a confirmed case goes, it would just be one for us.
Yeah.
Okay, thank you.
All right, we've got another question in the chat, but why don't we keep going, see if anybody else on the phone has a question first, and then we can go back to the chat box.
Okay.
So anybody else on the phone that would like to ask a question?
Yeah, Kevin, it's Bob Sobey again.
Uh-huh.
Is there a particular format in which you would want us to provide the health department with contact tracing data? I'm not sure what you're collecting, names and addresses and phone. I don't know.
I think all we would need, Bob, all we would need at this point would be names and a phone number, whether it be a home landline or a cell phone number.
Okay. All right. Thank you.
This is Lisa Segalo with Manistee County.
Yep.
As we approach the holidays, is there any suggestions you have on employee travel? And are there any areas, are they continuing to update the areas as hotspots?
That's the $1 million question, Lisa.
Okay.
You know, ever since, and Jordan and Brett, feel free to kind of jump in here if you want to. Travel has been, you know, initially when all this started, it was pretty easy because, you know, a lot of the international, you know, a lot of the international places, you know, were having many more cases than what we were having here in the U.S. And so it was easy to say if you shouldn't go there because the cases, you know, they're having many more cases. Now, though, it really has, you know, it's pretty much kind of leveled out. You know, you see on the news where, you know, there's outbreaks and so on. But I mean, honestly, when you look at domestic travel and so on, you know, is it any worse going to, let's say, Florida than it is to going to the grocery store? I mean, I don't really know. What I can tell you is that, you know, that the policy that the health department has in place, and we've talked long and hard about this and talked with our legal counsel and with our medical director, Dr. Morris, on this, is that for any domestic travel, when individuals return, they are required to wear their mask when they're in house at all times, which is no different than any other employee. For international travel, or if any individuals go on a cruise, they are required to quarantine for 14 days before they come back into the office. And that policy has been out there and everyone is aware of it. If you go out to the CDC website on travel, they will, you know, they'll list potential risks by air travel, by bus, by train, by car, and each of those has their own separate, you know, little risks associated with it. Some of them you wouldn't even have thought about. And then international, you know, they may direct you to, oh, there was a map and I can't remember. And we can get that information and send that to you because I know Dr. Morris referenced that a couple times. I don't know if it was by Harvard or someplace else where you could really drill down internationally to see where you're at, you know, where you're going is a potential hotspot. But travel is, you know, is really one of those things that we've kind of left up to the individual entities to make that decision on. I don't know how else to, you know, I don't know how any other guidance to provide you on that one. Brett or Jordan, if you guys have anything else?
No, that's about it.
Nope, I don't have anything else.
I'm sorry we don't, you know, I'm sorry I don't have a black and white answer for it, but it really is kind of the $1 million question.
All right. Thank you.
All right, why don't we do this chat box question and then we can go back to the phone if need be. So next question is, could you please talk again about definition of close contact and the isolation period for that?
Sure.
Specifically related to masked, unmasked, and days of isolation, 10 days or 14, and is it a change to date of last exposure versus what is on the DHD-10 website? Are all counties following this new process?
Okay. The isolation period is something that a positive individual will go through. So once someone is identified as being positive, then they will have to isolate. And that isolation period can be as short as 10 days. It can be a little bit longer, especially for an immunocompromised individual. But on average, it's 10 days. And the 10-day period would start from the onset of symptoms. Moving forward, that person would have to isolate. And at a minimum of 10 days, they can be released from isolation, provided that they are fever-free for 24 hours without using any fever-reducing medications. Their respiratory symptoms have improved, and then all other symptoms have improved. That would get the individual released out of isolation. Quarantine is what happens to individuals who are identified as a close contact to a positive person. And a close contact is going to be defined as anyone who has been within 6 feet of an individual, of a positive individual, with or without a mask for an accumulative of 15 an accumulative 15 minutes in a 24-hour period. And as I said, that could be 3 minutes in the morning, 5 minutes in the afternoon, 6 minutes in the evening. You know, it's that accumulative 15 minutes, which is a change because originally it was 15. It had to be a 15-minute period of time that you were exposed to them. Now it's an accumulative of 15 minutes within that 24-hour time frame. And that's with or without a mask. So the quarantine period would start, the length of that time is 14 full days from the last contact with a positive person. So that would be the example and definition of isolation, as well as the definition of quarantine. And yes, I believe everyone should be following the last change in the isolation period. Quarantine, I don't think has changed at all. Isolation, I believe, was back in August. There was a change, maybe it was September, but the change in that accumulative 15 minutes time frame.
And that was the last question in the chat box. Oh, just got another one. It says, is the exposure only related to the 24 hours prior to onset of symptoms or positive test? I got to move my thing back down. I can't see it. So I'll read it again. Is the exposure only related to the 24 hours prior to onset of symptoms or positive test? I had been told this was 48 hours.
It is 48 hours. Did I say 24 hours? We will begin to gather close contacts. If the person is symptomatic, we'll begin that process 48 hours prior to their symptoms starting. That is what would be considered the start of their infectious period. So if you know, I'll use Bob because Bob had asked the question. So if Bob started to have symptoms today in trying to identify all of his close contacts, we would go back 48 hours, which would mean Sunday and Monday would be considered the start of that infectious period. So we would begin to gather any close contacts that Bob may have had on that Sunday and Monday. And if it's the person is asymptomatic, then that 48-hour time frame is 48 hours prior to their test.
And to add to that, Kevin, the question is, so is the 15 minutes cumulative in 24 hours or cumulative in 48 hours?
No, cumulative in 24 hours. So it's an accumulative 15 minutes in a 24-hour period.
Okay, that was the last question in the chat box. Anybody on the phone?
All right. Then the other, I guess the other big question is does this group want to continue this type of format for an update? And, what frequency would you like to see this? Is it something you want weekly, every other week, once a month?
Hey, Kevin, Jason Torres from Manistee.
Yep.
I would like to get back on track with this on maybe a weekly basis for now, since our numbers just keep going up pretty good.
Okay.
Kevin, Chief Kozel, Ludington. I would agree. It'd be nice just to get back into our weeklies if we could.
Okay. So what we could do, because I see in the chat there's kind of biweekly and weekly, and we can schedule. I would think, Brett, we could schedule a weekly call, and then those that want to get on weekly can, and those that want to do every other week can. I mean, the format will be, will pretty much be the same. We'll put Jordan on the spot and have her review the data that's out there, and then we'll provide any other updates and answer questions that people have. Our individual county calls, some of them have gotten down to, where maybe it was just 30 minutes. But if you're okay with that, we can, and assuming this day and this time would work for everybody. Take that as a yes. We can schedule it moving forward. We can do this, schedule a weekly call, and for people that want to get on weekly, they can, and other people, if they want to get on just every other week or once a month, you can do that. But at least we would have the option available to do that, and maybe we'll look at scheduling those we can schedule them maybe through the end of the calendar year and just see what happens. If the group feels we don't need to do these anymore, we can cancel them. If we want to continue them, we can do that. But I would think we can make that available on a weekly basis and for all 10 of our counties, and we'll see what happens moving forward. Does that sound good? All right, then unless anybody has anything else, I think that's all that we have. Brett, I don't know if you have anything.
Nothing for me.
Okay, and then you can kind of send out a weekly invite for this time frame.
Yep. So I'll set it up as a reoccurring weekly invite. And then, like I said, there is some lag time. I've got to get an email with the recording back. So there'll be some lag time, but in a couple days after the meeting, it will get posted each week to our website. And like I said, I will send out an email to let everybody know when and where that is.
Okay. And then, you'll have you'll have an opportunity to hear a weekly update or every other week, whatever you're able to make, we'll look at doing that. And Jordan, that will work okay for you?
Works for me.
All right. Then again, if there's nothing else, again, thank you guys for taking time to get on the call. If at any time you have any questions on anything, don't hesitate to reach out and contact me. If I can't answer it, I can find somebody that can answer it for you. And other than that, thank you, and stay safe and have a good day, guys.
Thank you.
Thank you.
You too. Thanks.